So how do you know if you have ADHD? This is something that's gone around in the psychology literature for a long time. Let's see if we can nail that down today. ADHD. It comes up quite a bit. You know what? I believe that this is a condition that is both underdiagnosed and overdiagnosed. Let me tell you where I'm coming from on that, because as a child psychologist early in my career, almost any symptom group or presentation that came up with kids could be interpreted as ADHD, attention deficit hyperactivity disorder, because the kid's bouncing off the walls. Usually, quite often, that diagnosis was more related to a frustrated adult than it was to a hyperactive kid. Meaning the kid's just being a kid. And it's frustrating the teacher, the parents, the people who are trying to work with this kid in a way that their bounciness didn't lend itself to. So I think it got overdiagnosed a lot, especially several years ago with kids. On the other hand, I think it may be underdiagnosed in adults, which is kind of a weird dichotomy, because to have the diagnosis of ADHD as an adult, you had to have had it as a kid too. Maybe they were diagnosed, maybe they weren't as a child. And so if they weren't, then an adult might be experiencing ADHD that has never been diagnosed. And in that sense, I'm saying it's probably more likely that it's underdiagnosed in an adult population. Why are we even asking this diagnostic question? I have a positive psychology practice now, and so I stopped diagnosing my clients. And notice I don't call them patients. I used to. I don't anymore. I don't give anybody a diagnosis. You come to see me, you don't get a diagnosis, even if you deserve one. Now, why is that? Some of that has to do with my personal philosophies about what human beings are all about. The other part of it has to do with what is the utility or the usefulness of that in the first place. So let's talk about the utility of a diagnosis. Why do you want to know? And if you came upon this video, either you're subscribed to the channel, thank you, love that, or you searched this out because you're interested in how to find out if this is really a thing that's going on for you, okay? Or somebody shared this with you. For whatever reasons that you came across this video, let's take a hard look at why do we want to know? What would it help if I were able to put this label on what I'm experiencing? And that gets back to my philosophy about people. I think we have experiences, some of which we can categorize and describe in terms of a diagnosis, but that's not the most interesting or important thing about a person. If you have a diagnosable ADHD condition in yourself or one of your kids or whatever, what does that mean about you? Well, let's make sure we don't over or underinterpret that, okay? Because it is what it is, and it's no more and no less. I hate it when people take a diagnosis and use that as an excuse for not performing at a level that they could, for not meeting whatever goals they have, or having the rich, joyful experience in life that they could have if they didn't have the diagnosis, right? It's more of a victim mentality. So let's get completely away from that, and then I think it can be a useful question. Because if this is a constellation of symptoms that seems to be common for a lot of different people, then we can start paying attention to, okay, so what works and what doesn't as we're dealing with that particular shared experience. So I know I'm getting a little philosophical on you here. Be careful with information. I'm going to share with you some of the characteristics, some of the ways that you might be able to see if your experience matches the experience that people who are diagnosed with attention deficit disorder, what they're experiencing. And then we can use that perhaps to look at what you might be able to do about it. So with that disclaimer, here we go. How do you know if you have ADHD? This is a condition that affects primarily a person's ability to focus and concentrate and remain attentive to a particular task for an extended period of time. About 4 to 5% of US adults have a diagnosable condition. Few of those actually seek treatment or get help for it. So it's not like it's the most common thing that could happen, but it's happening enough that we probably ought to notice it, maybe pay attention to it, see what we can do about it. So if you are adult and suspect that you might have ADHD, you might experience some of these things. A difficulty in following directions, difficulty in remembering information, having a hard time concentrating or organizing your tasks, having a hard time finishing work on time. Okay, now, by their nature, all of these things are hard, okay? That's why we call them work, typically. So what we're talking about here is a difficulty in these particular areas that exceeds or is more than what we would normally expect for a person in a similar stage of life and level of intelligence. Okay, so that's what we're looking at. Here's a few other things that might be relevant there. I'll just read to you from a list here. Anxiety, chronic boredom, chronic lateness and forgetfulness, depression, which is kind of like the fever of mental illness. Depression isn't often the problem. Usually depression is an indicator that there's a problem. Kind of like a fever is an indicator of some kind of an infection or disease process in a physical sense. Trouble concentrating when reading, trouble controlling anger, problems at work, impulsiveness, a low tolerance for frustration, low self-esteem, mood swings. These are pretty general symptoms, but they're often associated with ADHD. So if you're seeing the things that I mentioned earlier in connection with some of these particular difficulties, it might fit you. It might. Okay, there can be other contributing factors as well. Now, this probably goes without saying. Everyone is different. Okay, so two people who may both have a diagnosable condition of ADHD could experience it very differently or have a different set of symptoms that are contributing to it. So let's go back to the question that I asked up front. Why do you want to know? And what if? What if you are experiencing ADHD? Okay, valid question. Let's take a look at some of the things that you can do. The first and probably most important thing that I could encourage you to do is something that Dr. Ed Hallowell referred to as brain maintenance. Now, Dr. Hallowell is a psychiatrist who himself experiences ADHD. So he's coming from a position of personal experience as well as his professional training and medical background. His point was that in the ADHD brain, you have to do some things to maintain your brain functioning and allow yourself to compensate for or overcome some of the deficits that can come up with ADHD. And by the way, these people tend to be more creative. They tend to have more flow of ideas than people without the condition. So there can be upsides and downsides. Dr. Hallowell's point is that let's take care of the brain. 4 steps to brain maintenance. I've mentioned these before. You may recognize them from some of our other videos. Number 1, get enough sleep. Enormously important to take care of the sleep part of your brain hygiene. Number 2 is to eat a balanced diet. I'm not a nutritionist. I'm not here to advise you about your diet, other than you need to understand that the fuel you put through your brain makes a difference and puts you in position to handle some of the things that are associated with ADHD that you're going to need that resource for. So eat a balanced diet. Number 3, this isn't going to surprise you, regular exercise. Regular exercise. We're talking 3 to 5 times a week of at least a half hour of good aerobic exercise that gets your heart rate up, that gets the blood pumping, the oxygen flowing in your bloodstream. Now, it's obvious that this is going to help your physical health, but that's what we're talking about because your brain is part of your body. It's an organ in your physical body. So these things are going to affect that organ probably more than some of the others because your brain is the most vital organ in your body. So your body's going to take care of that one first. The fourth one has to do with mindfulness, prayer, meditation, solitude, quieting, focused breathing, relaxation. So I use the word mindfulness. I think Dr. Hallowell used prayer and meditation, kind of with a hyphen in between. So I'm not here as your spiritual advisor, but we're finding through the psychological and physiological research that your brain needs this for its own health. So brain maintenance, you can see how this is going to help with an ADHD condition. Now, the other thing that I would encourage you to do is put systems into place. Systems that work for you. So if you know you have a hard time organizing your tasks, find a tool. There are so many available, especially with the technology that we enjoy nowadays, that will take it off of your mind and put it into a system that you trust. I do this with my calendar, with my task lists, to put it into that system. Then I don't have to track it up here in my mind. I've got it in a system that I trust. And then I trust myself to go to my system. And that's where I find it. So putting those systems into place is going to be very helpful as well. Brain maintenance, take care of yourself. Now notice, this is going to be helpful whether or not you have the diagnosis. If you do, it's probably even more important. But even if you don't, there are reasons why you wonder if maybe you do. That means that you could benefit from these steps as well. So just get busy taking proactive control over those things that you can. Let's not worry too much about the diagnosis per se. That might be helpful information, but that's not the most interesting thing about you. So maybe you have it, maybe you don't. Maybe you know more about that today, and at least there's some things you can do about it. Thanks for watching Live on Purpose TV.